Are you tired of quick fixes that promise transformation, but leave you feeling more disconnected from your body than ever? Welcome to the Beyond Medicine Humanized Care for Women of Influence, where we go deeper than surface level solutions. I'm Dr. Maria, a functional integrative physician specializing in women's health, metabolic dysfunction, and hormone balance. We will uncover the root causes of insulin resistance, PCOS, thyroid, and adrenal issues, and explore how trauma, stress, and anxiety impact your well being. Because your body's not a microwave and it deserves personalized, compassionate care that honors its complexity. Let's embark on a journey to reclaim your health one conversation at a time. So, welcome to today's episode where I have with me Dr. Behrens. She is a board certified family physician and founder of Vida Family Medicine right here in Texas. And we will be discussing today how we can nourish our bodies for health no matter our size. So, welcome to the show, Dr. Behrens. Go ahead, introduce yourself, tell us a little bit about you and anything that you want people to know as they start to hear our conversation for today.
Yeah, absolutely. So thanks so much for having me. My name is Rebecca Behrens. I'm a family physician, as you said, and I started my practice, Vida Family Medicine, back in January of 2020. So we're almost 5 years old as of this recording. And yeah, so I started the practice for a similar reason that a lot of us, I think, go into private practice. I was working in health safety net healthcare systems or corporate healthcare systems that were very rushed, very focused on numbers and not on the patient. And I really wanted to bring back some of that humanity into medicine and be able to connect with my patients on a human level and have a human relationship. And that I think is healing for both of us.
Yeah, so thank you for sharing that. So let's start to talk a little bit about today's topic. And me personally, I talk a lot about how to nourish our bodies. But for me, it's very important that people also develop a good relationship with their bodies. If we're going to fix something, not necessarily because this is not good and the body's not good, but perhaps because there's a health concern that maybe we want to do this. So tell us a little bit about why you are also passionate about helping people nourish their bodies in a way that is more health focused rather than size focused.
Yeah, I actually had an eating disorder when I was in college. And that experience was very formative for me in terms of the way that I practice because I, through the process of developing and then recovering from that eating disorder, realized how much our societal focus on weight as a measure of health and on body appearance and as a measure of health. That's not the only thing that goes into developing an eating disorder, but it is a driver of a lot of the symptoms. And it was very important to me not to contribute to that. And when I see patients who are struggling with a health concern or a family history of various health concerns, they are often very health conscious. But because of the way our society is so focused on appearances and on a certain body ideal, it can lead people actually into very destructive behaviors and habits for good intentions of trying to keep themselves healthier, but they're not actually focused on health as much as they are focused on this societal ideal body image. And so it's trying to really bring back that focus as to what is actually going to be helpful for you in nourishing your body, in feeling mentally and physically healthy, in able to do the things that you want to do in your life without being dragged down by this sort of negativity that is so pervasive. And I think it's the whole diet culture and weight stigma is very baked into medicine because in medicine, we're humans too. We're influenced by the same culture. And so it's sometimes very difficult to tease out what is actually evidence-based medicine and what
Mm.
is the influence of diet culture and weight stigma in us giving recommendations to patients. And so it's helping patients tease that out and finding for themselves what is going to be most healthy for them. And that may not look like a certain number on the scale, a certain diet that you're following. It's a little bit more complicated than that. And so that's very important to me just to fight back against a little bit of that cultural stigma that we experience.
Yeah. So thank you for sharing that. So there was a couple of things that you mentioned that I just want to go back and piggyback. And the first thing, because we're physicians, I'm going to start with so those evidence-based either recommendations or guidelines that people that we can share, right, with our patients or that we can even share with the general public that again are going to be more focused on the health rather than the body appearance. Like again, for me as a child, I had problems with my blood sugar level and a couple of other things. A lot of what I do to take care of my body more than because of the size or is because again, I don't want to develop diabetes again. I get a little bit of anxiety every time that I go to check my A1C. So, can you share maybe some of those things that when you're taking care of your patients that you try to focus on that are evidence based, that are still going to help them be healthy, yet at the same time drawing them maybe away from I call it the noise of the culture that sometimes can create like also a lot of confusion.
Yeah. So I think that so many of the recommendations that people hear, or like if they go online, like especially right now, we're recording this in January. It's the new year, new you, right? Follow the new diet. Here's the new thing. So much of that is built around restriction and
Mhm,
stop doing this, cut out this, you're wrong for doing this. There does not need to be any restriction in nourishing yourselves. What needs to happen is you need to be adding the things that your body needs. Your body
mhm,
needs fiber, your body needs protein, your body needs movement, your body needs sleep. Adding more of those things rather than restricting those things from your body, because psychologically, the difference in how that affects you mentally and also physically, there is a physical harm to constantly feeling deprived.
mhm,
And that is so baked into like our psychology. And I think if we look at recommendations of stop, no versus add, give yourself more of this, like that is such a huge mindset distinction. It makes such a
mhm.
huge difference for people. And it's also evidence based. Like we need more sleep, we need more fiber, we need more things to better care of ourselves rather than constantly taking away from ourselves. So that's the biggest piece that I focus on. And it doesn't end up necessarily being all that different. It's more just the way that you're looking at it and the way that you're treating your body when you're making a change. Like rather than taking something from myself, I am giving more to myself.
Yes, and I also like that because that's also one of the things that I say, can we add more like vegetables? Can we think of how can we add more legumes or yes, even if it's just 50 minutes more of sleep at nighttime. So I absolutely agree. And then the other thing that you mentioned, which yes, completely agree, is moving away from this restriction mindset, this scarcity mindset or this mindset that just puts us like, I call it a jail. And then you feel like you're in jail and not enjoy life. And is finding maybe, I'm going to use the word balance because it's the only one that comes to my mind. But as I tell my patients, sometimes I do eat the pizza. Sometimes I do have the wine. I have the guava that I love from traditional Puerto Rican meals. Yet I choose also at the same, a very conscious decision not to do that every day of my life because, again, I was a child that was growing sick. And I also know what that did to like my body and not in the shape of the body. But for me, a lot of it was like the energy at school and how I was just not able to, I really wanted to sleep, right? My energy was really low. So I just wanted to sleep all day. So thank you for sharing that. The other thing that you mentioned is, and I think that you mentioned it in the context of the individual patient. So, how can you develop like that ideal way? And you said eating, but I think that also this ideal way of taking care of, for me in my practice, like the whole you, the entire you that might not necessarily work for somebody else because I think that also the type of job that you have, if you have kids, if you don't have kids, what age is there? I mean, all of that comes into context. But can you unpack maybe when you are working with a patient, like how is it that you help them discover what that ideal is for that?
Yeah. So I think one thing is just starting from scratch, knowing this is not something that we're going to like transform overnight. In fact, if you make a big drastic transformation very quickly, that is not sustainable. It's not going to last. So it's identifying what are some things that I could do today, maybe one or two things that I could do today to take better care of myself. Let's focus on those things first. Let's get those well established into my habit, into my routine. Now they're easy for me. They don't require any thought. And then once those are working, is there something else we want to focus on next? But not just, I think, especially like I said, at the new year, it's like, new year, new you, like everything's going to change. No, you can't expect that you will make a drastic transformation like that overnight and be able to sustain it, because everything else in your life is still going to be the same. You're still going to have the same stressors. If you've got little kids in school or little kids who don't sleep at night, it's not going to happen that you're going to be able to have the energy and the ability to keep up with a big lifestyle overhaul, right? But you can make some small changes gradually over time, and those are going to add up to huge benefit for you over like years down the line if you keep them up consistently. But you can't expect yourself to fix everything as if we're broken, right? We're not broken. You make small adjustments to improve your life little by little, and that is going to add up over many, many years. It's going to compound like interest. But you can't expect that it's just going to magically be perfect tomorrow.
Yes. And I love that you said you are not broken. And I think that a lot of the times, because so in medicine, one thing is you have a strep, you need the antibiotic that is easy, quick, fast to fix. But then there are other things in terms of health and wellness that absolutely are going to take a little bit of not only time, but trial and error, because we also live in this environment and this culture, and we are not completely under control of everything that surrounds us. But I think that approaching again from this mindset of like, I'm not a problem that needs to be fixed, but rather again, developing this more nurturing, compassionate, graceful relationship with ourselves is extremely important. And I think that also in that, and I'm going to ask you a question about this, also comes the importance of exploring what I call your food story. And what I mean by that is, for example, in Puerto Rico, it's not only the way that we culturally eat, but a lot of festivities and everything revolves around food and certain types of food at certain times of the year. Yet, growing up, I was meatball and my older sister was spaghetti. So you get the idea, right? Spaghetti and meatball and that sort of thing. And even thought people say it when you're growing up, when you were a kid, sometimes people think that doesn't have a psyche here. It does. And so two questions here. One is, right, how do you help your patients perhaps also explore that food story in their cultural context, and even what do they want to keep of that? But at the same time, how do you help in this case, what two questions separately, parents understand that there is an effect not only on maybe how you allowed your child to eat when they are like growing up. And what I mean about this is not necessarily the restriction, but it's even, for example, the fact that, I don't know, during the weekends, you might let them go the entire day with not a nourishing meal until the end of the day because there's no like structure or routine. But then also the fact that words can actually do have an impact in this relationship with the body.
Mhm. Yeah. And so that, like I was saying before, eating disorders are not just about the food or the weight, right? There's all these other layers to it. And this is absolutely where a lot of that comes from. Childhood experiences, childhood traumas, all of these things affect the way that we later may have a difficulty with food or eating. And so a lot of my patients either have had an eating disorder and are in recovery, or struggled with disordered eating. So maybe doesn't quite meet diagnostic criteria for an eating disorder, but there was disorder in their eating patterns through childhood, young adulthood on. So this is something that definitely comes up and we talk about. And for me, this is the importance of a care team. So
Mm,
the doctor is not the expert on all of these things. And I have some wonderful therapists and dietitians that I work closely with who can help the patient address all of these things from the different angles. But I think from the doctor side of things, it's just the acknowledgement and the I believe you. Because
Mhm.
so many patients that I see, especially those who maybe are in a larger body, have gone to the doctor, have expressed a concern, and have been so dismissed or so belittled that they're lying, that you're just lazy, that just all of these things that they're hearing. Again, because the medical profession, we're humans who grew up in this culture, all the same biases and stigmas are inherent. And so it's just that acknowledgement and the listening and hearing and believing the experience of the patient and recognizing the impact that has had and calling that out and saying, like, this is the thing that happened to you. This does not define the rest of your life. And let's work on this how we can here medically. Let's have some therapeutic support from a psychological standpoint, from be it a therapist, a psychiatrist for the trauma, the other stressors in your life, whatever else has been going on that needs to be worked on. Let's get a dietitian who is culturally competent and not going to try to force you into one specific diet that they think is correct, but recognizes your cultural upbringing, the cultural foods that are important to your family, the importance of that culture in your identity, and not taking it away to try to meet a certain ideal. And so all those parts of the team working together to really help the patient kind of come at everything from a holistic perspective.
Yes, and I think that is extremely important. I feel that there are some things in medicine, again, that they're easier to address. And it's not that it is not something that can be treated, but I think that there is some layer of complexity. I'm going to use that word that therefore requires a little bit more of care and gentleness as we approach this. Absolutely. And as we're talking about eating disorders, I am going to poke here a little bit more and talk about a topic that I know that is out there. But I'm going to do it from the perspective of the eating disorders. And this is patients that perhaps come to you. They do want to use a GLP-1 type of medication, yet they have a history of eating disorder, and it is not clear that they have still been able to recuperate from that eating disorder or that unhealthy relationship with food. And they're still in this struggle with food, right? So there's still this unhealthy food is almost like their enemy, right? And independently of if they actually have a body size that necessitates a large amount of like weight loss or the use of the medications. But when you have a patient that perhaps is thinking of using these medications because there is an underlying issue still with food and the relationship with their body in terms of like how do they look? How do you address this with the patients? And what perhaps would you tell to the people that are listening to us?
Yeah. So this is a huge topic. It comes up all the time. Very common conversation that I have. I think part of it is being very honest and open with ourselves about what has been going on. Where are you mentally around food? Are you working with a therapist? Are you working with a dietitian? What progress has been made? What things are you still struggling with? What are you hoping this medication is going to do for you? Are you going to be trying to use this medication to help suppress the appetite that you have because of the periods of restriction that you've put your body through? And you're trying to unnaturally suppress that? Or are you struggling with some metabolic issues that are, despite all of your best efforts, with all the work that you've been doing, you just are not able to overcome? It's being very open and honest with like the patient being honest with themselves and with me and us, the team having communication. Because what I see as a doctor, I may miss something that the therapist sees coming up in a session or that the dietitian sees coming up in a session. Are we all in communication with each other to be able to pick up on those cues that maybe something is going awry again? So before we would consider proceeding with a medication like that, it's making sure that we all are on the same page. We all have a common goal of you nourishing yourself well and being healthier and not focused on how much weight can we lose with this medication? How much appetite can we suppress? How much, not focusing so much on these like sort of arbitrary numbers that, again, in medicine, I think we're so focused on numbers because we're analytical people generally. And it's like, what is the number? How can we get the number to look pretty? That's not what our focus is. Are you physically and mentally where you want to be to live your life in the best way for you? Does this medication move you closer to that goal? Or is it contributing to some of those disordered thoughts, feelings, or behaviors that you engaged in the past or are still engaging in? And so it's a very open conversation. And I think there's been cases that I've had where it has worked really well and the patient's been able to make still a lot of progress on dealing with their mental health struggles, their relationship with food in their body, and also improving some metabolic markers using a medication because we're working well as a team. And the times when it does not go well is when there's not a team and or the patient is not being honest with themselves. And so I think it's an important conversation. But I think this is why it's very important if you're considering using a medication like this, that you're working with a doctor who is taking all of that into account. If you're going to a place in a strip mall that is giving you a shot once a week and not having any conversations, that is likely not going to be a safe or sustainable way for you to use that medication. Whether or not it's compounded or pharmaceutical grade or what it does, the environment and the conversation that you're having is very important. And I think it does matter where you get the medication and who is monitoring the medication. And I think that's very important to state.
Yes. And I completely agree. Just because, again, I have had some patients that have been going to one of these places that, so they're not only having the conversation, but they're also not monitoring their labs and certain things, which there's some patient safety issues involved that I'm not going to go into right now. But also what I have noticed is that some of these patients have had an eating disorder or are still struggling with it. And as I said, eating disorder, I'm not talking about somebody that has a larger body and has an eating disorder, and that's the issue. There's a wide spectrum of eating disorders. So I want to clarify that. And my take on it is that as physicians, we should also be assessing for that. Not because that might not be a reason why not to use some of these medications and help our patients. But I think that having that awareness of this is something that we cannot just put under the rug and forget that it's there, if that makes sense. Because I think that helping our patients heal in this entire whole person beyond the way that they might look is extremely important. And then the other thing that I try to help my patients focus on, especially when they might not be hitting some weight goals as quick and fast as they wanted, is, but how are you starting to feel in your body? And when you also shift that focus and they start to understand, oh, yeah, I'm sleeping better. I have more energy. I can focus at work. I don't feel so tired, so fatigued. And I think that this also helps then also create sustainable lifestyle behaviors and lifestyle changes, because then it's not only about how they look, but how they feel. So I don't know your thoughts in that area.
Yeah. And for me, I very much stay away from weight goals because
Hmm.
I always tell patients, like, we are not in control of what your body does with your weight. We're not in control of that. And the more you try to control that, the more you are likely to be engaging in harmful behaviors
Mhm.
because you can absolutely force things by doing some very restrictive and harmful things, but that is ultimately less healthy than being at a higher weight with sustainable, healthy behaviors. And so for me, especially if someone is using, say, a GLP-1 medication, my goal is making sure the weight loss is not too rapid if there is weight loss happening, rather than, oh, can we get the weight to XYZ number? Can we get the BMI to XYZ number? I'm not trying to force it into a specific area. My goal is, let's not lose weight too quickly, because if we're losing weight very quickly, we know that is not safe or sustainable.
Mm.
I can't control what the weight number is, but I can look at, like you said, how you're sleeping, how your energy level is, how you're feeling, how your like mental health and relationship with your body is improving all of that tells me so much more than the scale. Like I frankly don't really care what the scale is as long as it's not dropping too quickly because that's an indicator that things are not going well. And so it's very important to make sure that we're focusing on the non-scale outcomes because the scale outcomes are really not in our control. The other thing is, I think a lot of people, what I've noticed if they are trying to lose weight, maybe like intentionally reducing caloric intake and increasing activity, trying to lose weight, often what will happen is there may be some initial weight loss and then there's some metabolic adaptation. So your body readapts. And so in order to force that number down, you have to do ever more restricting things. And then we start to see loss of bone density, loss of muscle mass. That we know is not healthy. It is healthier for you to stay at a higher weight and have strong muscles and strong bones that are going to carry you into old age and continue to be physically active than it is to lose weight, but be losing muscle and bone mass. And so that's just an important distinction. And so I always tell patients, I don't have a weight goal for you. I don't want you to focus on weight as the outcome. That's not the outcome we're going for. What we're going for is feeling good, feeling like able to do the things that you want to do in your life and having a good relationship with your body.
Yes. And I think that when you said, one, you cannot control your body, but then also the one thing that I like is so you're not focused on the outcome that the scale is telling you. And it reminds me of a patient that I had probably at this point, like maybe 5 years ago. And I remember that this patient, she verbalized, why do I need to be weighed every time that I come to the clinic? Now, at that time, I was working again in the traditional healthcare system where, as a physician, there are some check marks that you have to do, right? Because if you're going to submit to the insurance, because the quality metrics. And again, blood pressure, I can understand, but waiting your patients every time, I think going back, medicine is very number focused. That by itself was something that for that particular patient was detrimental, was stressful. And she used her voice, which I think that was great. And I remember I instructed our only workaround was I told the MA, just wait her with her back so that she never would see like the number. And that was something, a conversation that I wouldn't have with her of, hey, because sometimes also the conversation is your weight went up by this much or down by this much. And sometimes that can be a non-friendly conversation that patients want to have with their own bodies because of the relationship, because maybe they're not ready. But I think that's one of the beauties of maybe not having to meet all of those metrics. Then you don't have to be focused or measuring certain things every time because you have to meet the metrics and send a report and be able to build certain things. So the one thing that I wanted to piggyback as we come more towards the close is you have mentioned the words or the phrase a couple of times, which is harmful behaviors. So for people listening, whether they for themselves, a loved one, a lot of the times eating disorders are seen more as a female issue, but we know that it also exists in the male population. Parents, nieces, because I think that this is something that anybody that has a loved one or a friend that sees what you're talking about harmful behaviors can maybe go. So one, when you talk about harmful behaviors, can you maybe give us an idea or examples of what there are? And maybe if the relationship is safe, right between these two people, perhaps what could be a good way of maybe approaching it or having
Yeah.
a conversation.
Yeah. And this is so tricky. And I know it's really hard for people because a lot of people do recognize that there's something going on and they're not sure what to do. So, some behaviors that I think are really common that are important to notice is if someone's made a big diet change, like all of a sudden I'm vegan, all of a sudden I'm vegetarian, all of a sudden I'm not eating XYZ food group, cutting out entire food groups, making big diet changes that are not based on maybe like their cultural upbringing or their religious upbringing, like something that's very sudden and restrictive, that's sort of a flag. And no, not medically dictated. For example, if you're diagnosed with celiac disease, obviously you're no longer eating gluten. That's very different than I don't eat carbs anymore.
Yeah.
Things that those sort of big, sudden, drastic diet changes. Eating in secret or not eating and avoiding public situations where eating is happening, maybe skipping family events, skipping parties, not eating much at parties anymore, avoiding eating in public, going to the bathroom right after eating. So people who purge after eating, when maybe they induce vomiting, maybe they use or abuse laxatives or diuretics, so they're going to the bathroom quickly after meals. Finding evidence of hidden eating. So like for in a child's room, for example, finding lots of empty bags of or packages of food, plates, things that were hidden in the room. So like secret eating. Those are all some signs. A sudden change in interest in some. So for a lot of people, when there's a lot of restriction, they'll suddenly become really interested in cooking or baking or have a new interest in that. And they're doing a lot of cooking and baking, but they're not eating any of it. They're giving it to other people. Those are some common signs that I see. There's not always going to be a weight change. And I think this is one of the things, or at least not a noticeable one. I think this is a lot of the thing that people will see when they notice these behaviors. They're like, they still look okay. They still look the same. They haven't lost a lot of weight, so it's probably fine. That does not mean it's fine. There's still a lot of harm that can happen without significant weight loss. And especially psychologically, what's going on can still be really dangerous and really harmful. And what I think people don't realize is eating disorders are actually the psychiatric disorders with the highest mortality rate, except for opiate abuse. Obviously, we know that opiate abuse has a very high mortality rate from overdose. Eating disorders are right under that. And sometimes it's from medical complications of the eating disorder, but sometimes it's from suicide. And the suicide risk is really high. So all eating disorders and disordered eating behaviors are important to address, even if there is not a big weight change. And I think it's so important for people to realize that just because the person still looks okay, that does not mean things are okay. And there still can be serious medical consequences. So it's important to intervene, as you've suggested. In terms of managing it, I do think it's very important not to comment on weight. Because that's something that may be very preoccupying for the person. So if you notice someone has lost a lot of weight, saying things like, oh my gosh, you look so sick, like what happened? That's not helpful. If you notice that maybe they're no longer engaging in activities that like parties, like they're not coming to parties anymore, they're not going to events anymore, they're not eating at those events. Like, hey, are you feeling okay? Like, I know that normally I would have expected to see you at XYZ gathering, or I saw you weren't really interested in eating much today. Are you feeling okay? Are you feeling sick at all? And then just really trying to check in and connect with that person on a more of a like, how are you doing level than what's going on with your eating? What's going on with your weight? What's going on with this? Because if you focus on the behaviors and like really hone in on that or focus on the weight, you're just perpetuating that cycle. But checking in and making a connection with that person, showing that you're a safe person for them to come to, showing that you care about them, showing that you value their presence at events, you value their connection with you. That's really important too. You're going to be able to disrupt some behaviors just by having that connection, and they may feel more comfortable coming to you. When you're a parent of a child, obviously you're going to see a lot more. And when it's a child, there's a lot more you have to do. We cannot control what another adult does with their life. We can be a support, we can be there for them, but we can't force them anywhere. When you're a parent of a child, like you take your child to the doctor, you bring your concerns up to the doctor, and you help your child get treatment because you still can. And it is so important to engage with and disrupt these behaviors and address these concerns as early as possible, because the longer it's been going on, the harder it is. And eating disorders have a high relapse rate anyway. But the earlier you can intervene, the lower the risk of this becoming a lifelong struggle for this person. So if you're a parent of a child, absolutely, this is so important for you to take your child to the doctor, tell them the concerns you have. If the doctor's not taking it seriously, take them to another one because it is important. Even if they are not severely underweight or whatever yet, it is important to address.
Yes. So thank you for sharing that. I do want to add at least two other like harmful behaviors that I have also observed that I think that is important. I don't necessarily know statistic wise how common they are, but is in terms of purging, you can also do it with like exercise.
Oh, yes.
Exercise, or you eat something and then you have to exercise some amount, see if you burn the calories, that sort of behavior. And
yes, thank you. That's a huge one. I can't believe I missed that one.
Yeah. Okay. And then and the other one that again, this is a little bit harder to maybe even observe, but I do know of people that weigh themselves like every day, every day, every day, every day,
Mhm.
and they keep track of it. And there is some obsession around the weight. And again, you might not be able to observe this because they might be also be doing it in hiding or in privacy, like in the bathroom with the door closed. But it's one of the other things that I wanted to mention. And then finally, I wanted to say you talked a lot about relationships. And when it comes to healing any sort of mental health that has behaviors that are related and that affect our brain and our body, like addiction, eating disorder, trauma. The relationship is like so important in the healing process. And I once heard Dr. Dan Allender, he's a therapist, famous out of Washington. And one of the things that he explained that made a lot of sense is that very early on at a younger age, people tend to develop unhealthy relationships either with food or with sex. Because when a child is growing up and they don't have the attunement and the presence of an adult, their own body becomes like that tool that they will have then to feel attuned and to go into kind of like, how do I help myself with those emotions? And it becomes their own body. And that's why usually problems or unhealthy behaviors around food and sex tend to develop very early on. And that for me made a lot of sense. So I do wanted to bring and reinforce the importance of focusing more on the relationship, trying to again fix the behavior that is wrong and there's a problem here. So you as a person are a problem because a lot of the times that's not helpful.
Yeah.
So, Dr. Burns, as we come towards the end, so one, do you have any last thoughts or comments on this topic that you want to make sure that the listeners hear them? And then the other thing, do you want to tell our listeners if they want to know a little bit more about yourself, they're interested in working with you, how they can get a hold of you?
Yeah, I do want to share just a couple of resources around eating disorders. If you are someone who's concerned about a loved one that you can go to that again have maybe resource listings. If you're a parent, obviously your child's pediatrician is a great place to start. But if you are working with someone who's an adult that you can't make them go to seek medical attention, you can help connect them to resources. So there's the Alliance for Eating Disorders, which is allianceforeatingdisorders.com. And then there's also National Eating Disorders Association, which is nationaleatingdisorders.org. And they both have some listings of resources available, as well as quizzes and things you can take to help identify level of risk. So that's just some resources that I wanted to share. My practice is in the Sugarland area of Houston. So we were in the Heights and we moved out to Sugarland last year. We are serving the greater Houston area. And actually I have patients all over Texas as well that I can see virtually. So we are happy to see any new patients. Like I said, I love working with patients who are recovering from disordered eating because a lot of times you mentioned before, going to the doctor, getting weighed every time, it actually becomes a barrier to seeking medical care. And we see that a lot of the patients who have experienced weight stigma have worse healthcare outcomes, not necessarily because of anything related to their metabolic health or any of that, but just because of delayed diagnosis or missed screenings or because they've missed medical care. It is important to have a place you can go where you feel safe, where you do not feel that every medical visit is going to become about your weight. I've had patients tell me they went in for an ear infection and they got lectured on their weight. They went in for a broken arm and they got lectured about their weight. Completely unrelated, but it just becomes the focus of the visit. So it's an important thing for us at my practice that we are sensitive to that and we do not focus on that. So if you're someone who has been avoiding care because of that concern, we would love to help.
Awesome. Thank you. Thank you for sharing that. And then for the listeners, I will put in the show notes the links to the resources that Dr. Behrens mentioned, as well as a link for her practice so that you also know where you can click and get a hold of her. So thank you for being here. I hope that this conversation was enlightening for everybody. And most of all, I hope that we were able to approach it with the care and the gentleness that I know that it deserves. And that also, if you are somebody listening to this and this has been your story, that we approach it with the care and the honor that it deserves. So thank you, ladies, for being here. Until next time, bye.